How's it going, everybody? And in this video we're going to be talking about the innervation of the leg. And so this is going to be a pretty big video, but we're going to try to walk through the landmarks to reason our way through why these nerves are what they are. And so what I have here is a prosection of the right leg. We're looking at the posterior view of it, and we have reflected some muscles here. I've reflected the gluteus maximus muscle, so we're not seeing that, so that we can actually observe our sciatic nerve right here. And so we'll get started. So the very first landmarks to look at when you are doing this is this guy right here. So this is a really important muscle. It's called your piriformis muscle. And the reason why we care so much about piriformis is because if you look right here, you can see the sciatic nerve passing right underneath it. And so in some patients, their piriformis muscle is actually two heads. It's got two heads, and the sciatic nerve cuts through that gap between those two heads, and it can pinch that sciatic nerve. And so if patients complain of like a stinging or a tingling sensation down their leg, it could be caused by something called piriformis syndrome, where that muscle is hypertonic and it's pressing down on that sciatic nerve. And so that's just a little background on why we care so much about sciatic nerve and the piriformis muscle in terms of a landmark. And so you can't really see it too well here, but basically sciatic nerve, honestly, it's one of the biggest nerves in your body. It's huge. And the reason it's so huge is because it's going to innervate a lot of stuff, and that's the reason why we're starting with it. And so the muscles you see right here on that posterior side are generically called your hamstring muscles, and another term for them is we're just going to refer to them as hamstrings. But basically what we're going to do is going to be a little bit more explicit here. I'm going to start out by defining what is medial and lateral. So we're looking at the posterior leg right now. We know the toe in this picture is going to be on our left. So that means that this side is the medial side, and this side is going to be the lateral side. And that'll be important for our reference. So when we are looking at these muscles, the key things to take away are that you've got your semitendinosus muscle right here on the left on the medial side, and then you've also got your semimembranosus muscle that's running underneath it. And these muscles are going to make up that hamstring. The job of this guy, if you look down here, you can see what's called pes anserinus, goose foot in Latin. And the reason why that's an important landmark is because that's where these muscles are attaching onto the leg. The leg is that anatomical part that's between the knee and the foot. So basically you've got these two guys grabbing on right there in addition to that sartorius muscle. And so by doing that, they're able to, when they are contracting, when they're firing, they're helping to flex your leg. So they're helping to, if you're running, for instance, that's what's helping you flex at the knee. So those are two of the muscles of those hamstrings. The other muscle, or technically two muscles here, is going to be called your biceps femoris. And specifically, the one that's most superficial, so the one you can see on the outside, is going to be the biceps femoris long head. And then deep to that, so I'll do some dashes here, it's going to be the biceps femoris short head. And so all of these muscles are important because what happens to your sciatic nerve is that it's going to run underneath them, and when it does, your sciatic nerve in here is going to break into two branches. So it's going to have a medial branch as well as a lateral branch. And this medial branch is, as you can see here, it kind of goes through those condyles on the femur. This guy is what we refer to as the tibial nerve, TN. And then there's this other guy that decides to branch off laterally, and this lateral branch is going to be called the common fibular nerve. And so when you see the word common in a nerve name, it indicates that that nerve is about to break into more nerves. And so that's why it's important to us. And so we've got our tibial nerve now and our common fibular nerve, and these guys came from the sciatic nerve up here. So I'll try to be consistent with these color schemes. So we've got your sciatic nerve right here, cutting underneath that piriformis, and the tibial division of the sciatic nerve is going to be responsible for innervating the semimembranosus, semitendinosus, biceps femoris long head. And then the interesting curveball here is that the common fibular nerve actually innervates the short head of the biceps femoris. So that's a little trivia fact that a bunch of anatomy teachers like to hit kids with, is just saying what innervates biceps femoris short head, and in reality it's actually that common fibular branch off that sciatic nerve. So just make note of that as we're walking through this, and that's the reason why it's so important to not just talk about nerves but all these muscles as we work our way down the leg. And so now that we've done this, another little fun fact here while we're at it is, why do we care about piriformis and all these other muscles like the gemellus superior, gemellus inferior, and obturator internus? These guys are all involved with lateral rotation or internal rotation of the leg. So you're seeing how they're grabbing onto the greater trochanter of the femur, so the most lateral part of that femur, and they are what's responsible for helping you, move your foot outwards. Okay, and so with that out of the way, we're going to keep working down here. So we've got our tibial nerve, and what's going to happen to your tibial nerve? So your tibial nerve is going to keep running down basically the entire length of the leg. And I want to make note here that I have reflected the gastrocnemius muscles as well as the soleus muscle. And so if we added those muscles, you would not see this, but in this popliteal space, the popliteal fossa, which is basically equivalent to like the cubit of the leg, but in terms of the arm, what you're going to see here is that tibial nerve is going to just keep running down as it normally would, and the tibial nerve stays tibial nerve, and it goes all the way down here, down to this little process that you can palpate very readily. This is on the medial side of your foot or your ankle, so we're going to call this the medial malleolus. And so medial malleolus is this bony feature, and so if you think inferior to that is going to run that tibial nerve. And so the tibial nerve is going to be responsible for innervating the posterior compartment in your leg. Very important. And then another thing to note here is that we've got our common fibular nerve and our tibial nerve that divided from our sciatic nerve up in the posterior thigh. And they do a nice little get-together thing, and they become this cutaneous nerve. And when they do that, they come together. I apologize, this might be a little bit hard to see, but what I want to make note of is that they become this nerve that is called the sural nerve. And so the sural nerve comes from the Latin sura, which literally means calf. And so a little Latin, again, goes a long way here with all this anatomy. But basically, the whole purpose of the sural nerve is to provide sensory innervation to the skin, the cutaneous stuff on your lower leg. So if someone was feeling your lower leg right now, you can thank your sural nerve for the reason why you're able to feel any of it. And so with that out of the way, we're now going to be looking at this common fibular nerve in a little bit more detail. So why was it called common in the first place? We called it common because the common fibular nerve, this guy right here, is going to do two things. It's going to have a deep branch and it's going to have a lateral branch. So the branch that kind of goes deep is going to go medially. This guy is going to be called deep fibular nerve. And then there's this other branch, I'll try to make this clear. There's this other branch that goes more laterally, and this guy is going to be called your superficial fibular nerve. And so superficial fibular nerve is going to innervate your lateral leg compartment. And so these would be muscles like fibularis longus and fibularis brevis. And so with that, that is the key thing to make note of here. I do also want to say that your sural nerve is going to keep running down the remainder of your posterior leg, and it is going to wrap around the bony process called your lateral malleolus. So that's a very important landmark. You palpate it. If you see a nerve running underneath that, you know that that is going to be called your sural nerve. Another note I'm going to make here, while we can still kind of see it from this view, is that that sural nerve is going to keep going anteriorly. So now we're moving into the page from this view. And when we do this, we're just going to make note that we're on the lateral side of the foot, and the naming convention on this is actually pretty nice. This is going to be called the lateral dorsal cutaneous nerve of our foot. And so that is the key innervation to take away from this view that we have of our posterior leg and thigh. Final note that I will make here is that we've reflected gastroc and the soleus muscles, but we can still see some other muscles in the way here. So there's this little guy right here with a very long tendon. It attaches all the way down to your calcaneus bone. This is called your plantaris muscle. And then you wonder what these other deeper muscles are in here. These guys are going to be called your flexor digitorum longus, as well as flexor hallucis longus. And so the tendons from these guys are going to also run underneath your tarsal tunnel. So this space right in here is called your tarsal tunnel, similar to how your hand or your wrist has that carpal tunnel. And so these guys are going to swing underneath the foot, and they're going to be involved with how you flex your toes and your great toe, or the hallux, or that's why we call it hallucis. But yeah, so that's the key innervation we should be taking away from this view. And now what we're going to do is we're going to look at the anterior side of our thigh and leg. So it's a little bit of the dorsal foot, and we've got another slide on that one. But basically, when you're looking at this stuff, the key landmark to start with is going to be called what is your femoral triangle. So this ligament right here is called your inguinal ligament. So that's a very important landmark when you're looking at a cadaver. And what you're going to note about this guy is that this is attaching these bony processes on your pelvis. This is going to be very palpatable. So this guy right here, the most anterior thing on your pelvis, is called your anterior superior iliac spine, ASIS, because this is your ilium that's running up right there. So that's your ASIS, and then that's one of the key attachment sites for your inguinal ligament. Now what we're going to do is we're going to walk down slowly, and I'm going to try to use interesting colors here. So I want to make note here how we see a triangle being formed in this region by the top part is this inguinal ligament. And because we're now looking at the anterior view of our leg, we're switching directions here. So now the right is going to be medial, the left is now going to be lateral. And so what is going on here is that you have your rectus femoris, but I have slightly removed some muscle layers here. What you typically would have in terms of a muscle in this region is going to be your sartorius muscle, and that guy has been reflected in this particular slide. But the other key muscle that you're seeing here that is definitely part of this femoral triangle is going to be called your adductor longus. And so adductor longus is an important landmark also when you're defining this triangle. And the reason why we care so much about this triangle isn't just for the sake of naming it, it's because what we see here, this nerve coming in here, as soon as it comes into here, it's going to be called your femoral nerve. And in addition to your femoral nerve, you're also going to have the artery and vein running here. So it's a very important landmark for us to be able to recognize when you are doing anatomy. And so working our way down here, you would have your sartorius muscle coming in here that kind of wraps around from the lateral side to the medial side as it moves distally. So this muscle right here would be called your sartorius and your sartorius muscle is part of what defines your femoral triangle. So adductor longus, inguinal ligament, and sartorius muscle are the three boundaries for this femoral triangle, and that's how you can locate on a cadaver the femoral nerve artery vein. And so next up, what we're going to be doing is tracing what happens to this femoral nerve. So the femoral nerve gives off a very important cutaneous branch that we care a lot about. And so this guy right here is going to be a very important sensory innervation, and it basically runs distally down our whole leg, just like this. And so it's the terminal branch of our femoral nerve for this part, and this guy is going to be called your saphenous nerve. Okay, so that's an important part. And then you are noting here how on this we see that the femoral nerve basically runs down this sartorial channel or groove in the leg. So it did give off a very important branch, so we cared about that saphenous branch or nerve. That is something that is picking up a lot of sensory innervation for us. And so another key nerve to take note of in this is going to be your obturator nerve. And so when you're looking at adductor longus, if you look at it from an anterior to posterior view, you're going to have adductor longus being the most anterior muscle. Then you have a muscle just below that called adductor brevis. And then finally, you've got another muscle called adductor magnus. Adductor magnus is a huge muscle. It's also the most posterior of all of your adductor muscles. So these are the things that help you maintain your balance on your stance leg when you're walking or running. So it's very important. And so with these guys, what happens is that you've got your obturator nerve right here come in. Your obturator nerve is going to have an anterior branch. So this will be the anterior branch of the obturator nerve. And then you're also going to have a posterior branch of the obturator nerve. And I apologize if that's illegible. But hopefully we get the idea. Posterior branch obturator nerve is going to be the guy that goes in between the adductor brevis and adductor magnus, and then the anterior branch goes between adductor longus and brevis, and then the posterior branch goes between brevis and magnus. So that's another important landmark to make note of that you can't really see too well from this posterior view, but just this is something you need to commit to memory if you're going to be taking an anatomy practical like I am. So those are key landmarks. Other things to take away from this particular slide for key landmarks are going to be the following. So in our anterior leg compartment, or anterior thigh compartment, what we have are the following. So we've got our quadriceps muscles. So this top guy right here is called rectus femoris. Rectus femoris attaches onto AIIS. So the anterior inferior iliac spine is that bony process on the pelvis. And then laterally to that, you've got vastus lateralis. Medial to that, you're going to have vastus medialis. And then deep to rectus femoris is going to be vastus intermedius. And so these four muscles, so 1, 2, 3, 4, are what make up your quads. And so these guys are what is involved with extending at the knee. So when you're kicking a ball, for instance, you're engaging your quads. And so these are those four muscles that we need to care about in that situation. And so by knowing that we've got our femoral nerve very close by, we know that our quads are going to be innervated by that femoral nerve. And then that other nerve the nerve that's innervating our medial compartment, that inner thigh compartment, the medial compartment of our thigh is going to be this obturator nerve right here. And so obturator nerve is a very important other one. I'll just spell that out all the way. So obturator nerve. Okay. And so now what we do is we're going to keep walking down the front of our leg here. And so what we noted is that on the posterior leg, we had the sciatic nerve give off that lateral branch, and we called that lateral branch the common fibular nerve. And then what the common fibular nerve does is it gets these two branches right here. And so this branch that kind of runs into this and goes deep is going to be called the deep fibular nerve. And then we also have a branch that is going to stay superficial and innervate those two muscles that we talked about on the previous slide. And so this guy is going to be called your superficial fibular nerve. Superficial fibular nerve. Okay, and so your deep fibular nerve is going to innervate the anterior compartment of your leg. So innervations on this guy are going to be the following. So you're going to have your tibialis anterior muscle. You're also going to have your flexor digitorum longus muscle. And then if you open up these two muscles on a cadaver, you're going to see in between them, so deep to them, you will see, this is actually extensor digitorum longus. It's going to be called extensor hallucis longus. And so these are the key muscles to be taken away, and these three guys are what's getting innervated by this deep fibular nerve on the anterior leg. Now, when we look at our superficial fibular nerve, the two muscles again that we need to think about here is going to be your fibularis longus muscle and then your fibularis brevis muscle. And so these guys are going to keep running down the leg just like so. And I should use the appropriate terminology. And so this is what we end up with. And so now what we're going to do is we're going to take a look at our plantar foot. And so again, having to orient ourselves, we're going to note that we've got our big toe right here. So this side is going to be medial. This side's going to be lateral. Your tarsal tunnel is going to be right here. This bone that you see right here is going to be your calcaneus bone. And so the key landmarks to take away from here is that coming out of your tarsal tunnel is going to be this nerve right here, which was your tibial nerve. So that whole nerve that did the posterior innervation, or the innervation of your posterior leg compartment, tibial nerve, is going to come up in here, and then it's going to break into these two branches. And so this is the plantar foot, and so we're going to name this appropriately. We're going to call this guy the medial plantar nerve, and we're going to call this guy the lateral plantar nerve. And so once we've done this, we can see which muscles these guys are going to innervate. And again, we're not looking at the most superficial muscles in this particular slide, but the muscles that we are seeing right here are going to be the following. So this guy right here is going to be quadratus plantae, because it's on the plantar foot. And what you're going to note that quadratus plantae does is it actually grabs onto this tendon, and this tendon is your flexor digitorum longus. And so flexor digitorum longus is being pulled on, and it's getting assistance from quadratus plantae on that plantar foot. And the whole reason it's doing this is because it's trying to flex all of these digits, or these phalanges of your toes. Another thing you're going to make note of here is that we have this extrinsic muscle coming in. This guy is going to be your flexor hallucis longus. muscle, but specifically it's tendon that you're seeing on that plantar foot, because the muscle is actually way up higher in the leg. And flexor hallucis longus is coming from that posterior leg compartment that was innervated by that tibial nerve, so it's all kind of coming together. And so those are the key points to be taken away from that. And then finally, what we see here also in terms of key muscles to note is that on the very lateral side, we are going to have, at the superficial layer, we are going to have the abductor digiti minimi. Literally just means small digit, so that's small toe. And then on the medial side, superficial to all this stuff, we would of course see our plantar aponeurosis that we'd have to reflect, but deep to that, we would also run into the abductor hallucis muscle. And so the job of that muscle is going to be abducting or pulling away the big toe from the rest of the body. And so these are the key things to take away from this. Another thing I will say from this diagram is you see all these little muscles in the foot here. What you want to know about them is that they are called the lumbrical muscles, so just lumbricals. And so lumbricals are kind of occupying that space at or between the flexor digitorum longus. And then if you were to reflect this further and take away even more of this, you can kind of make it out a little bit. Try to use a good color here. I'll just do a little bit of erasing. What I want you to note here is how do you see you see the number 7. So if you reflect all these lumbricals, what you're going to note is that you've got 2 muscles, or well, 2 heads. They're the same muscle, but when they contract, what they're going to do is adduct the hallucis, the great toe right here. And so this guy right here is going to be called the transverse head of the adductor hallucis muscle. And this guy right here is going to be called the oblique head of adductor hallucis muscle right there. Try to keep the handwriting neat. But yeah, so there you go. That is the key muscles and innervations for this. I will say also from this view, you can see that nerve. So this was that lateral dorsal cutaneous nerve of the foot. So that was an important landmark. And yeah, I'm going to wrap things up with that. I hope you guys find this helpful. Let me know if you have any questions. I hope everyone out there is doing well, and I'll talk to you guys next time.